to the University of Iowa Clubfoot Clinic. We are here today to discuss the importance of the brace for clubfoot treatment and how to use the brace correctly. Clubfoot treatment has two important steps. The first step is the series of casts that stretches and corrects your child's feet. The second step is the brace, which is used to maintain the correction that the cast made.
The brace is made of a pair of shoes connected to a bar. The shoes and the bar work together to help prevent a relapse. A relapse is when your child's foot returns to the clubfoot. Your child's foot grows fast early in life, and if the brace is not used correctly, your child is much more likely to have a relapse.
Statistics show families who do not use the brace the way their doctor advises are 183 times more likely to have a clubfoot relapse. Your child will need to wear the brace for at least 4 years to prevent a clubfoot relapse. If the brace is not worn for the right amount of time during the first year, 9 out of 10 children will have a relapse. During the second year, 7 out of 10 children will relapse. And even during the third year, 3 out of 10 children are still relapsing if the brace is not worn correctly.
Treating a relapse often means more casts when your child can walk. Your child may also need a surgery to correct the relapse. In addition, the bracing schedule may need to be restarted after the relapse is fixed.
It is important to make using the brace part of your daily habit. Even a few nights out of the brace will make it harder for both you and your child the next time you use the brace. A few nights out of the brace will let your child get used to moving their legs freely. The next time they wear the brace to bed, they will have to relearn how to sleep comfortably in the brace.
Your child will start wearing the brace the day the last cast is removed. The brace will be worn 23 hours a day for the first 3 months. Most parents use the hour out of the brace for bathing time. After 3 months, your child will wear the brace 16 to 18 hours a day. As they grow more active, their time in the brace will decrease. By the time they can walk, they will be wearing the brace 10 to 12 hours a day, usually at night or during nap times. This is the goal until they're 5 years old. If your child is already walking or crawling when it's time to use the brace, talk to your child's doctor about how long they need to wear the brace.
First, you will want to make sure your child is wearing soft, thin cotton socks that are long enough to go above the top buckle of the shoes. Make sure the socks are pulled smooth against your child's skin. Any pants or leggings should be pushed out of the way of the brace buckles. The buckles on the shoe will be on the inside of your child's foot. Make sure all the flaps on the shoe are pushed back and slide your child's heel to the back and bottom part of the shoe. Check the holes in the heel of the shoe to make sure the foot is in the right position. Use one hand to hold your child's foot in the right position and use your other hand to pull the tongue over the middle of the foot. Make sure you pull the tongue snugly and smoothly over the ankle joint. Even a little pucker in the fabric may make the shoe too loose. Always buckle the middle strap first. The middle strap is the most important one for making sure the shoe is on right. The strap should be pulled tight enough so the foot cannot wiggle in the shoe. Now you can buckle the top strap over the ankle. Make sure everything is smooth over your child's skin. Then move to the toe strap. You will want these straps to be snug against the foot too. After all the straps are buckled, check the shoe fit one more time. Look through the holes to see if the heel is in the right spot and try to move the shoe to check that it is on snugly. If it looks like the shoe is not on correctly, find out what's wrong and fix the problem. Here are things to check each time you put a shoe on your child. 1. Make sure your child's heel is as far down and back in the shoe as possible. Readjust the tongue and middle strap until the foot is in the shoe the right way. Retighten any straps that may have come loose. After you have the first shoe on, repeat the steps for the other foot. Even if your child has only one club foot, both feet will still need to be put in the shoes snugly, just as we demonstrated.
When both the shoes are on, it's time to attach the bar. The shoes alone do not keep your child's feet healthy. They need both the shoes and the bar to keep their feet corrected. On the bottom of the bar, there is an R and an L for your child's right and left foot. There are also numbers on the bottom of the bar, which tell how far your child's feet are turned out when in the brace. Your doctor will prescribe the correct angle for your child's feet, but a rule of thumb is the clubfoot will face out at 60 degrees and the non-club foot will be placed at 30 degrees. The bar itself should be long enough to keep your child's feet approximately shoulder width apart. This is the most comfortable position for your child. To put the bar on the shoes, there's a groove in the bottom of the shoes where the bar will slide and click into place. Now you have successfully helped your child into the brace. There is no special way to take the shoes off your child. To take the bar off the shoes, simply push on the tab that says push and gently pull the bar out simultaneously. Most parents find it easier to take the bar off before taking the shoes off.
Always have your child wear soft, thin cotton socks when in the brace. If your child does get a sore area from the brace, you can use a little bit of moleskin. Simply put the moleskin to the part of the shoe that's irritating your child's skin. If your child has a sore that's not healing quickly, call your child's doctor.
It's normal for your child's foot to have some redness. This redness should go away within having the shoes off for 20 minutes. It is also normal for your child's leg and ankle area to be smaller where the straps of the shoes sit. If you see this, it is a good thing. This means your child is wearing the brace regularly.
Redness and blisters that do not go away are not normal. Just like when anyone has a pair of shoes that aren't fitting correctly, they are bound to get redness or blisters. You need to find out what part of the shoe is irritating your child's skin. The most common reason is that the straps are too loose. The straps being too loose is the leading cause of redness or blisters. When the straps are loose, your child can move in the shoes of the brace. This movement rubs on their skin and leads to irritation. Your child has outgrown the shoes. If their toes are to the edge or over the edge of the shoe, it is time to call your child's doctor to order a bigger size. The straps may be too tight, or the fabric of the shoes or socks is not smooth against the skin. Talk to your child's doctor if your child's skin is getting sore in the brace. Never stop using the brace unless your child's doctor advises. Talk to your child's doctor if your child's skin is getting sore in the brace. Never stop using the brace unless your child's doctor advises.
The biggest tip we hear from successful parents is that you have to make the brace part of your daily routine.
The second thing parents say is it gets easier with practice. Making the brace part of your daily routine is the best thing you can do for your child so they grow with healthy and active feet. The brace does not keep your child back from reaching key developmental milestones. Your child will learn how to crawl and walk even though they're wearing the brace every day. It is also normal for your child to learn how to crawl and stand in the brace. Just make sure to keep them safe when they're playing in their brace.
Playing with your child in the brace will help them get used to how they can move in the brace. It's normal for them to cry and be fussy in the brace. It's important to find ways to soothe your child without removing the brace. Their crying at first is because they're not used to having the brace holding their legs together, not because they're in pain. You can soothe your child and help them get used to the brace with a few exercises. You can gently move the bar up and down. This helps them see how they can move and kick their legs together. You can gently push and pull the brace to help your child learn how to bend their knees in the brace. And you can also teach them how they can move one knee at a time so they can learn how to twist in the brace. It's important to not remove the brace to soothe your child. Your child will quickly learn that crying will lead to you taking the brace off, and this is a hard cycle to change. You're doing the best thing for your child by helping them wear the brace. If you're unable to soothe your child and you feel that they're in a great deal of pain, call your child's doctor.
When your child is wearing the brace during the day, it may add new challenges to using items such as car seats, strollers, or high chairs. We have a few tips to help making these items easier to use every day. For a short amount of time, less than 30 minutes, you can leave the shoes on your child and just take the bar off to put your child in and out of their seat. When your child is out of their seat, just snap the bar back on the shoes. For longer amounts of times, more than 30 minutes, take the bar off before fastening them into their seat. And once they are safely in their seat, simply put the bar back on. When you go to take them out, remove the bar first and then put the bar back on once they are out.
Most parents find it useful to pad the bar of the brace to make it more comfortable when they're holding and feeding their child. It will also help to protect you, your child, and your furniture as your child learns to move about in the brace. To pad the brace, simply take 3/4 of an inch diameter pipe insulation and wrap it around the bar. You can find pipe insulation at your local hardware store, and it's easy to cut with scissors to the length of your child's bar. To hold the pipe insulation to the bar, you can tape it or find something like our luggage handle holder to wrap around it. Some parents will make their own wrap using a fun fabric their child likes and Velcro on the ends.
Parents find onesies with snaps are easiest to use to work around the brace. Do not use onesies that have footies. The extra materials from the footies may cause irritation to your child's skin. It is okay for your child to wear leggings or pants when in the brace, but make sure the extra material at the bottom of the leggings or pants is not tucked into the shoes, for this will cause more irritation to your child's skin. When your child is out of the brace, there is no restrictions to the clothing or shoes that they can wear. As your child gets older and they develop their fine motor skills, they may try to unbuckle their shoes. There are some things you can do to help stop them from doing this. The first thing you can do is make sure you're buying longer socks. You can simply fold the longer socks over the buckles of the shoe. Sometimes just the buckles being out of sight and out of mind is enough to stop your child from unbuckling the shoes. If this does not work, make sure the sock is long enough and you can tuck it to the bottom where the bar would normally go in the shoe, and then attach the bar to the shoe like you normally would. We hope this video has helped you get ready and set to help your child brace. There is a lot to know when getting ready for the bracing period, so take the time and ask your child's doctor any questions you have about the brace.
Remember that all the time and effort you put into helping your child wear the brace will put them one step closer to having pain-free and corrected feet.